Hello, welcome to my channel. My name is Bridget. I'm a nurse practitioner. Today we'll be going over 5 pharmacology NCLEX style questions, courtesy of nursing.com. Just wanted to give you a quick update. If you're watching this, between August 16 and August 24th, 2022, nursing.com is offering 40% off their 2-year plan. And in addition, anyone that starts a 2-year membership will receive a book bundle. That is a total savings of about $300. And the book bundle includes 140 must-know meds, 63 must-know lab values, Nursing Mnemonics, 2nd edition NCLEX review book. All right, let's get started. A nurse must give an injection to a client using the Z-track technique. Which of the following principles would the nurse keep in mind when using this technique to give the medicine? Select all that apply. So this is a select all that apply, first of all. Make sure that you don't miss that. With the Z-track method, if you remember, you pull the skin over to the side. So pull the overlying skin at the injection site. You need to use the appropriate needle length. You don't want to insert at a 45-degree angle. That's more sub-Q. And it can be used for any IM injection. Release the taut skin before removing the needle from the muscle? No. This was a hard question. 25% answered this correctly. So if you got it right, congrats. So you pull the skin to one side and the needle should be inserted at a 90-degree angle. And this is the appropriate size. And the correct practice is to withdraw the needle. Then you release the skin to trap the medication in the muscle tissue. The nurse understands that type 2 diabetes is considered a milder form of diabetes because which of the following? So this is an example of like when you don't always agree with like the test writers or you don't particularly like the question. I don't really like that they call it milder just because I have seen some terrible complications from uncontrolled type 2 diabetes, but the premise that they're going for here is that resistance to insulin. So type 1 diabetes used to be called like juvenile diabetes, but they are no longer calling it that because people are now we're seeing type 2 diabetes even in children as obesity rates continue to climb. Kind of like what I said, type 2 diabetes has many, many complications. So the best answer, even for a question that I didn't really like that much, because there's not a complete absence of insulin production as in type 1 diabetes, there is a lower than normal production of insulin or a resistance to insulin. This means that the body produces enough insulin to take care of fat and protein metabolism, but not enough to handle carbohydrate metabolism. The nurse is preparing the medications for a client. The client has an order for 25 milligrams of escitalopram. The medication comes in 10 milligram tabs. How many tabs will the nurse administer? So I'm not a math genius, but even this one we can do off the top of our head. 10 plus 10 is 20, so that's 2 tabs. And then we cut half a tab in order to get 5 milligrams. So it's going to be 2.5 tabs. Remember that we can't cut tablets that, for example, are extended release or open up capsules that are extended release. Seem to skip question 4, but I will not cheat you guys out of question. We will go back to one more question. A newly diagnosed client with type 2 diabetes has been prescribed metformin as an oral hypoglycemic agent. Which best describes how the nurse would explain this medication? This medication is used for type 2, but not for type 1. That's true. This is a type of oral insulin taken once a week. Not true. It's not true. It's taken every day. You will need to take this when your blood glucose levels get low. You can also use this medicine if you developed complications such as diabetic ketoacidosis. So this is the answer. And metformin should never be used to treat diabetic complications. And metformin is taken daily. This medication is like preventative, right? You don't take it like a headache medicine, like, oh, I have a headache, let me take ibuprofen. Oh, my blood sugar's high, let me take metformin. No, that's not how it works. You need to take it every day to control your blood glucose levels. And it works by increasing the liver's sensitivity to glucose levels in the blood. It's used exclusively in type 2 diabetes, not in type 1. And again, nursing.com provides these handy dandy videos if you need a refresher on a specific topic. As promised, I will do one more question since 4 somehow skipped. Which of the following drugs would most likely be prescribed as a PRN medication? So gentamicin is a antibiotic. Digoxin increases the contractility of the heart. It's an antidysrhythmic cardiac glycoside. Theophylline is sometimes used in asthma, bronchoconstriction, and it has a very narrow therapeutic window. Bisacodyl is a laxative stimulant. So this is a knowledge-based question. It's probably going to be easy on the rating. This would be your best option because if it's a laxative, it's only on there to be given as needed. PRN medications are those that are given on an as needed basis, and the nurse administers a PRN medication based on her judgment. And common PRN medications include laxatives and analgesics. Cardiac medications, they're typically not administered as PRN, and this is a cardiac medication. This is an antibiotic. Antibiotics should never be taken PRN because of antibiotic resistance, and this helps treat lung disease. So that's the 5 questions for today. Make sure that you hit the like button, make sure you subscribe, make sure you turn on that notification bell. If there's a specific category you want me to answer NCLEX questions on, such as respiratory, cardiac, ABGs, etc., then make sure that you drop a comment below.